Good morning and thank you. So, as we have seen in this symposium, initially Professor Alex, he gave us an overview of why ISAM should be involved in an activity such as Global Expert Network, followed by Mark giving us some examples from around the world of how such international global level collaborations can be helpful in addressing various research questions, not just research, but questions which can help us in defining our policies and practices across the world. Uh, Very important issue in this is the basics, nuts and bolts of how to put together such a system. So this exercise is very complex. To make it slightly easier for us, my colleague Dr. Preethy Kathiresan from Jodhpur, India, she is going to walk us through the kind of structures, systems, and mechanisms which are being put in place under global expert networks. So as we can see, we are now going more deeper into understanding how this whole system is being developed. So I'll not take much time. I'll request Dr. Preethy, who is joining us online, to start delivering her presentation, please.
Thanks a lot. Thank you, Atul, Ambekar, sir. I'm having echo. Good morning, one and all. I'm going to talk about the basic structure of ISAM Global Expert Net and the expert contact points from individuals to addiction societies and treatment centers. And I'm working as an assistant professor at AIIMS Jodhpur, and I'm also an assistant officer in the ISAM Global Expert Network. And I would like to acknowledge Professor Atul Ambekar, sir, for all his guidance and support. So basically, the ISAM Global Expert Network consists of the steering committee, which is kind of the main executive body. And then we have a group of assistant officers, and then we have a large group of the experts who form the global expert panel. So the steering committee consists of the three ISAM-GEN secretaries, Professor Alexander Baldacchino, sir, Dr. Hamidi Thierry, sir, and Professor Mark Potenza, sir. And we have the experts from different parts of the countries around the world who form the steering committee. And this is the group of assistant officers who help the steering committee members in all their ISAM-GEN activities, and I'm a part of it. And then we have the experts who form the global expert panel. So for a individual to form to join as an expert in the ISAM Global Expert Network, there are various pathways through which they can be selected. So they can be nominated by the ISAM Regional Council, or they can be nominated by the ISAM affiliated societies, or they can be a part of non-affiliated societies, or they can be from the ISAM mailing list, or from the ISAM 2020 COVID-19 survey participants, or they can be recommended by some experts. So based on the list of these experts, then there is a certain eligibility criteria, which I will be discussing later on, based on which we decide whether this person is suitable to be an expert in the addiction medicine field to join the global expert panel. So after those persons have joined as experts, we also try to recruit more and more experts by asking them to recommend further experts in their country, and then they are again reassessed to find whether they also fit in the eligibility criteria to form the experts. And based on it, the ISAM, the global expert panel is formed. And those experts who join can then choose whether they want to be part of some discipline committee so that they can work more on their area of interest, or they want to join some regional committees so that they can work more in their region. So there are opportunities for that also in the ISAM Global Expert Network. So this is the basic organizational hierarchy. So as I mentioned, there is a steering committee, which is the main executive body, and there is a group of assistant officers who help the steering committee members in all the activities. And then we have the steering committee members are actively collaborating with the external advisory board, and they have active engagement with the host institutes, funding agencies, international organizations, and the ISAM board of directors in order to formulate a proposal or a project. And then once the project or proposal is finalized, then they can approach the experts in the ISAM Global Expert Net, or they can approach those particular relevant regional committees or the discipline committees. So how a project is defined and developed under ISAM Global Expert Net. So a proposal to develop something, for example, a consensus statement or a guideline or a project, can be put forth by a member from the steering committee or a member of ISAM-GEN, or anyone else like an assistant officer or from an ISAM affiliated society, or even from the funding institutes. And then this proposal is evaluated by the steering committee along with an external advisory board and the relevant committees. And once after evaluation, we found that the proposal is suitable, then the funding institutes as well as the ISAM board of directors are funding a question for the project. And once the project proposal is finalized, then the protocol design is finalized by the proposing parties along with the support of the assistant officers, the steering committee members, along with the guidance from the relevant committees and the external expert advisory boards. And once the protocol is finalized, then we can go on with the data collection or the consensus development with the help of the assistant officers and relevant committees. So based on it, there are opportunities for developing different ISAM-GEN products like ISAM's guidelines, ISAM's expert surveys, ISAM's consensus statements, and ISAM World Addiction Medicine Report. So this is the basic workflow. So as we have seen that how experts are recruited under ISAM-GEN, when the organization, they can join in any of the committees like the regional committees or the discipline committees within the ISAM-GEN. And then we also saw how a proposal is made and how it is evaluated, how the funding is occurred, and how a protocol is finalized, and then how it is processed further in order to develop ISAM-GEN products. So coming to the World Addiction Medicine Reports, the ISAM-GEN service. So the aim of this surveys is to develop multi-phasic, cross-sectional and longitudinal global survey studies covering different aspects of addiction medicine. So we know that addiction, there are a lot of different aspects, and it can also be assessed at different levels. It can be at the local level, national level, regional level, or at global levels. Hence, the target participants of the survey should also be wide, and at the same time, they should be relevant for the question in mind. So there should be relevant stakeholders who are working in the addiction field, and those stakeholders should be relevant for the specific survey questions. So because of which, under the ISAM-GEN service, there are 4 main groups of survey participants. The first group is the addiction societies or the associations. The second one is the collaborating treatment centers or programs. The third one are the individual clinicians or experts, and the fourth one are the related stakeholders. So this addiction medicine societies or associations constitute the first group of survey targets, because so that we can ensure that there is an institutional representation, especially from the underrepresented countries and regions. So however, these addiction societies or organization access, they're accessed through the help of the ISAM Regional Council Network. So this ISAM Regional Council Network consists of the ISAM President, the ISAM Regional Council co-chairs, ISAM Regional Representatives, and chairs or representatives from the ISAM affiliated societies or organizations. So this is the ISAM Regional Council. So we have the ISAM President, Professor Alexander Baldacchino, sir, and we have the co-chairs, Dr. Gregory Bant and Dr. Hamid Ikhtiyari. And these are the regional representatives across the world who constitute the ISAM Regional Council. So ISAM currently has 23 affiliated societies around the world, and it has also initiated call for more societies to join the network. The first General Assembly was held on February 10, 2022, with participation of nearly 43 groups around the world. And the second General Assembly of Addiction Medicine Societies was held yesterday in person. This is the global distribution of the addiction medicine societies or associations around the world, and we can see the number of members in each societies or associations in the different countries. So coming to the second group of survey participants, which is the collaborating treatment centers or programs, it is necessary to include them because they are the important sources for recruiting treatment-related data. So for recruiting them, different types of treatment facilities or recruitment based on the prior known categorization. So we have low threshold services, specialized outpatient substance use disorder treatment services, hospital-based residential substance use disorder treatment services, non-hospital residential substance use disorder treatment services, mental health care services, and therapeutic communities and specialized social reintegration service. So in order to include these centers or the programs into the survey as a participant, they should fulfill certain eligibility criteria. That is, they should have at least 10 currently active patients in their facilities, or they should have at least 50 admissions per year in their treatment program. So in order to include them, we will be including the chief administrators of these treatment centers or programs participate in the survey. And the survey participants will also have to provide details about their roles and clinical responsibilities in their treatment centers or programs, along with any potential conflicts of interest, so that there can be transparency. So coming to the third group of survey participants, which is the individual experts, they are predominantly addiction medicine experts. In order to include a person as an addiction medicine expert as a survey participant, they should fulfill one of the following 5 criteria, as well as they should also self-identify themselves that they are an expert at the national or state level in their country. So the eligibility criteria is that that the person should be a clinical practitioner who has provided services to at least 50 patients with substance use disorder in the last 3 years. The person should be chairing, co-chairing, or vice chairing an academic or research department or institution related to mental health, public health, or addiction in a country or state. The person can be a person who is chairing, co-chairing, or vice chairing a WHO collaborating center or WHO affiliated office at the regional level or at the global level. Or the person can be the one who is having a vote or voice in decisions regarding policy making for substance use disorders at national or state level, or the person can be the one who is having relevant peer-reviewed publications in relevant areas. So if the person is fulfilling one of these 5 criteria and also self-identifies himself as an expert at the national or state level, then that person can be included as an expert in the survey. So in order to recruit the expert, it is a multiphasic process. And the purpose of this process is to formally include the expert opinion in the expert recruitment. So, and also we'll have an estimate of the saturation of the pool of the recruited experts based on the expert endorsement by other experts. So in the first phase, an initial core of experts will be formed based on the following. That is, as we discussed earlier, so the first group of experts will be formed by nominations by the ISAM affiliated societies as well as the ISAM regional representatives through the ISAM regional council. And they will also be included from the 2020 global survey participants who express interest and who fulfill eligibility criteria, members of WHO or UNODC collaborating centers, national research centers, universities, hospitals, etc., who also fulfill the criteria for this and who wants to join the ISAM Global Expert Net will be recruited. Members of the Arab League, African Union, EMCDDA, and other related addiction-focused intergovernmental institutions, and also experts on the mailing list of ISAM and other addiction science expert networks. They can also be included as the experts. And these experts are included if they meet the inclusion criteria and they report that they are interested in joining the ISAM Global Expert Network. So from this initial seed experts, we also ask them to recommend other experts who they think might meet the eligibility criteria. And from them, we again, the steering committee members then again appraise whether the second set of experts also fulfill the inclusion criteria. And if they fulfill, then they are also recruited as expert in the ISAM Global Expert Network. And this process is repeated till a saturation point is reached. And the saturation point is defined based on the overlap in the experts recommended by others and experts who had already been included. But expert invitations will continue for those countries in which there has been lesser number of representations. That is, they have less than 10 experts in the network from that country. So for the expert recruitment survey, the survey method has been created through an online platform, the Google form, which is circulated through the ISAM mailing list and also through the regional council members. And in the first round, the questions had been sent to nearly 1,377 individuals belonging to different disciplines under related to addiction. And the primary aim was to collect the demographic details, the professional details, and education related data. And 3 reminders were sent to them. And based on the response from the first round, questions were resent to the respondents of the first round, predominantly to get information about the scholarly publications of the experts and also about their affiliated addiction treatment center or clinic. And they were also requested to nominate other addiction medicine professionals who they think might be might fit the inclusion criteria to be included as an expert. And again, 3 reminders were sent to them also. And based on the collected information, they were screened based on the inclusion criteria, which I had already described. And those who qualify to be the expert based on the inclusion criteria, they were notified with a welcome email. And based on the collected information, they're also being used to invite new experts from countries where there is low representation. That's less than 10 included experts into the expert pool in the screening process. And this snowball sampling method is being planned to continue till we reach a record threshold that is minimum 10 experts from each country. So this is the distribution of the individual addiction medicine experts from all around the world, which we had been able to recruit during the first wave of our expert recruitment. So the benefits for the individual experts who join as an expert in the ISAM Global Expert Network is that they will be identified formally on the ISAM website. They will be offered ISAM membership fees waivers for a year after joining the ISAM Global Expert Network. They can also contribute to the publication that is coming out of these surveys as authors. So coming to the last group of the survey participants, which is the related stakeholders. So this is a wider group which can vary from the policymakers or program planners to the people from the pharmaceutical industry, or network or associations representing people who use drugs, etc. And they will be invited to specific parts of the global surface that would be relevant to their field of expertise. So the inclusion and exclusion criteria of these relevant stakeholders will be defined based on the specific requirements of each survey. So with this, I would like to conclude my speech. And this is the official email ID of our ISAM Global Expert Network. So in case of any queries or if anyone would like to join, they can mail it to this email ID.